Bonjour, Clyde. Well, since we covered the axial skeleton, or at least the skull and vertebral column, which is part of the axial skeleton, today we will do the appendicular skeleton. Most authors count the appendicular skeleton as only the bones of the appendages. Well, that may be true, but I usually include part of the axial skeleton in with this, such as the hyoid bone and the sternum and the ribs. I do that because it takes so long to get through the skull and the vertebral column. Anyway, this is part 2 of chapter 8, and we will pick up where we left off. I have some slides that are labeled. I have other slides that you will label to give you a little practice in just identifying things. Okay, so let's move on to slide 2, which is the hyoid bone. So here is the hyoid bone, which is situated between the mandible and the larynx or voice box. So shown there in the lower right, the position of the voice box, the front of that being the thyroid cartilage. Notice that the thyrohyoid membrane connects the two. The hyoid bone doesn't have a joint with any other bone. It is held in position by several muscle attachments and also by various ligaments, such as the thyrohyoid ligament shown there. We only have a couple of named parts. The hyoid bone has a body and it has 4 horns. So the 2 lesser horns are the small protrusions from the body, and then the continuation of the body out to the lateral aspects are called the greater horns or the greater cornua. Remember that cornu means horn, so those words are used interchangeably when referring to such projections that look like horns. Okay, that's all we have for the hyoid bone, so I don't have an unlabeled slide for it since there's only a few things to identify. Move along. Okay, what we have here is the most commonly fractured bone in the human body, and the reason for that is because we walk on 2 feet. If we fall, then we usually come down with our arm extended or perhaps come down right on the point of the shoulder. So the force is transferred directly to the clavicles, which oftentimes will fracture right about at the midline. So what you're looking at here is the right clavicle from the top down. So notice that it has a medial end which articulates with the sternum. It has a lateral end which articulates with the acromion process of the scapula. That little joint there, the AC or acromioclavicular joint, is a joint that is very fragile and easy to injure. So you oftentimes will hear about people having AC joint problems or shoulder pain. Okay, on the next slide, I have some lines and I will let you label yourself, and then if you activate the audio, then I will identify for you what I have drawn a line to. I think the most difficult thing about working with the clavicle is trying to determine is it the right or the left clavicle, because they will look different depending on whether you're looking at it from the top down or from the bottom up. Well, we have the right clavicle looking at it from the top down. Also, our angle here, it would be as if you're standing a little bit behind the person and looking down on their right clavicle. So that would put number 1 as the sternal end attached to the sternum. Number 2, that is simply the shaft of the clavicle. The little bump that projects downward. Okay, you can't hardly tell it in a diagram like this, but number 3 is pointed downward. That is the conoid tubercle. So you would need to make sure that you have the conoid tubercle on the bottom side, and the acromial end of the clavicle should be angled forward. Okay, so if we're standing and looking at this person's clavicle from the top down, and also we're positioned slightly behind the person, then number 4 angles forward. So the acromial end has to angle forward and the conoid tubercle has to be pointed downward. So we have the right clavicle top side, 1, 2, 3, and 4. Now imagine that you simply roll the clavicle over toward you. So you're standing slightly behind the person and you just roll it over coming toward you so that you look at the bottom surface. Well, then you can see that that also is the right clavicle. It's simply the bottom side. So it takes a little practice in getting oriented as to whether this thing is right or left. So number 5, that is simply the sternal end. Number 6, that is the conoid tubercle. And number 7 is the acromial end, which will articulate with the acromion process of the scapula. Okay, the anatomical parts of the scapula, sometimes called the shoulder blade. Uh, the image on the left side there, that is the front aspect or the anterior aspect of the right scapula. So we have some anatomical features there that you need to be informed about. First of all, that anteriorly directed projection there at the top, that is the acromion process. When we look at the backside, you can see that the acromion process is simply the anteriorly angled aspect of the spine of the scapula. We will see the spine of the scapula on the backside. So what you're seeing there is the spine of the scapula as it angles forward. That is the acromion process. It does articulate with the acromial end of the clavicle. Also, another anteriorly directed process, the coracoid process, coming off the front of the scapula there, just over the glenoid cavity, usually called the glenoid fossa. The glenoid fossa accommodates the head of the humerus to form the glenohumeral joint, the joint between the upper arm and the scapula. We have a lateral border and a medial border. We have an inferior angle and we have a superior angle. So from the front side, those are structures that you see. Now, the front aspect of the scapula is kind of a hollowed out area called the subscapular fossa. The subscapularis muscle occupies that fossa. So that will be a pattern that we will see on the backside also. So the image on the right is a posterior or backside view of the right scapula. So we have the spine of the scapula kind of advancing there. Notice that the acromion process is simply the anterior projection of the spine of the scapula. There is a hollowed out area just above the spine. So we call that the supraspinous fossa. And the muscle that occupies that space is called the supraspinatus. Just below the spine of the scapula is another hollowed out area. So we call that the infraspinous fossa, and the muscle that occupies that space is the infraspinatus. Okay, everything else that we have talked about on the front side can be seen also from the back. I think I failed to mention it's called there the scapular notch. Normally that's called the suprascapular notch, just that little depressed area there on the top side of the scapula. Okay, so that is the anatomy of the scapula, front and back. Let's move along. Okay, the first thing you would need to do here is get yourself oriented and realize which side you're looking at. So the image on the left, that is the right scapula from the back side. So that's the posterior view. You know that it's the back side because you can see the spine of the scapula. The image on the right, that also is the right scapula, looking at it from the side. So you're looking at as if you were staring right at the right arm. Okay, let's go through and identify these as they are numbered. So number one, that is the supraspinous fossa. It sits above the spine of the scapula. The muscle that occupies that space is the supraspinatus. Number two, that is the suprascapular notch. Number three, that is the superior angle of the scapula. Number four, that is simply the anterior protrusion of the spine of the scapula. So we call that the acromion process. Number five, that is the coracoid process. Number six is the spine of the scapula. Number seven is the glenoid fossa. Number eight is the lateral border. Number nine is the medial border. And number 10 is the infraspinous fossa, which accommodates the muscle called infraspinatus. Okay, moving over to the image on the right, number 11, that is the acromion process. Number 12, that is the coracoid process. Number 13 is the spine of the scapula. Number 14 is the glenoid fossa. And number 15 is the lateral border of the scapula. So how did you do? Well, keep working at it. You'll get it. All right, I'm sure you recognize the sternum, which is positioned directly in front of the heart, offering whatever protection it can offer to the organs of the chest. Up at the top, we have the manubrium. There is a dip right in the middle of the manubrium called the jugular notch. And then we have another little dip on the right and left side where the clavicles attach to the sternum. Those are called the clavicular notches. Not labeled there, but right below the clavicular notch on the right and left side, that is the first articulation facet, or the articulation facet for the first rib. The sternum attaches to 7 ribs directly. So those are called true ribs because they attach directly to the sternum. There are 3 ribs which share the same band of cartilage. That one band of cartilage for those 3 ribs attaches. Those are called the false ribs. And then there are 2 ribs on each side that don't attach to the sternum. So those are called floating ribs. So on the sides of the sternum, you have the facets for the ribs that do attach. So there are 7 that attach directly, 3 that attach by way of a common band of cartilage, and then there are 2 ribs on each side that don't attach at all. Okay, south of the manubrium, we have kind of a joint between the manubrium and the body of the sternum. That is called the sternal angle or the angle of Lewis. Down at the bottom, we have the xiphoid process. the xiphoid process attaching to the body of the sternum at the xiphisternal joint. Xiphoid means like a sword, so I guess you can see where it would have gotten that name. Okay, so that is the anatomy of the sternum, and I have one for you to label on the next slide. Well, I hope you didn't have any trouble identifying these. We just went over them. There's not that many to recognize on the sternum. So sitting up there at number 1, that is the jugular notch. Number 2, that is the manubrium. Number 3, that is the clavicular notch. Number 4 is called the sternal angle. Number 5 is the body of the sternum. Number 6 is the xiphoid process. And number 7 are the articulation facets for the ribs. Well, I hope you got all those right. That should be about the easiest thing we have here. Well, we have 12 ribs on each side. All of them articulate with 2 different vertebrae, the vertebrae above and the vertebrae below. So there is an articular facet to join to the vertebrae above. There is an articular facet to join to the vertebrae below. And then there is a tubercle on which there is a smooth area where another joint occurs, and the rib articulates again with the vertebrae below that particular rib. So that end of the rib is called the head. The rib also has a neck. The rib has a shaft. And on the undersurface or bottom aspect of the shaft of the rib, there is a costal groove in which runs the intercostal arteries, the intercostal veins, and the intercostal nerves. At the distal end, 7 of the ribs will attach by means of hyaline cartilage to the sternum. 3 of the ribs on each side will share a band of hyaline cartilage. That band of hyaline cartilage will also attach to the sternum. And then the last 2 ribs on each side, that's number 11 and number 12 on each side, reach only about halfway around the body and end there. So they do not attach to the sternum. So that's the general structure of the ribs with some modifications as we go down. For instance, rib number 1 doesn't look anything like this, but all the same, it does have some similar structures. Okay, once again, identifying structures on the humerus, the first challenge is to determine do you have the right or do you have the left humerus? Well, there are 2 things that you can use to tell you whether it's right or left. First of all, the head of the humerus has to be pointed toward the body's midline. In order to articulate with the glenoid fossa of the scapula, the head has to be pointed toward the body's midline. Point number 2, there is a deep fossa on the backside distal end of the humerus. That is the olecranon fossa. It's very easy to identify. It has to be on the back side. So you would orient the humerus such that the head is pointed toward the midline. The olecranon fossa is on the back side. So when you do that, then what you know, the image on the left, that is the left humerus from the back side. So get that oriented. We're looking at the left humerus from the backside. There is an anatomical neck. That is a groove that runs around the base of the head of the humerus. It is actually an anatomical structure. The surgical neck is not an anatomical structure. It's just an area. It's called the surgical neck because if the humerus breaks, it usually breaks there. So it's just an area, it's not an anatomical structure. Okay, the extended portion or the long portion of any bone is called the shaft. There is deltoid tuberosity. It's not labeled in the image on the left. It's a bump where the deltoideus muscle attaches to the humerus. It makes a big bump there on the side. You can see it, but it's not labeled. Okay, going down to the distal end of the left humerus from the back side, the obvious olecranon fossa is there. We call areas that are smooth and rounded where a joint takes place, we call those condyles. Well, there are regions or areas above the condyles, so we call them epicondyles. So the humerus has a lateral and a medial epicondyle, the area of the bone that is over the condyles, which are smooth, rounded surfaces where a joint takes place. Well, we should be okay with just calling those the medial and lateral humeral condyles. Well, some smart guys decided that they needed to give them particular names. So, what we would call the radial condyle uh, at the distal end of the humerus is named the capitulum. The the smooth rounded surface that articulates with the ulna is called the trochlea. So those are just smooth rounded surfaces where joints occur between the humerus and the radius, and then the humerus and the ulna. Okay, in the image on the right, you can see both of the tubercles. That is the front side of the left humerus. So looking at the left arm from the front side, notice that the head has to be pointed toward the body's midline. You don't see the olecranon fossa from the front because it's on the back side of the arm. Okay, you do have the head. You should be able to see the anatomical neck there. Running along the sides of the humerus are the greater tubercle and the lesser tubercle. There is a groove between those two called the intertubercular groove. That is where the tendon of the biceps brachii passes through there as it goes up toward the scapula. Okay, the bump on the lateral aspect of the humerus is the deltoid tuberosity. So down at the distal end on the front side, you should be able to identify the medial epicondyle and the lateral epicondyle. On the very distal part where the joint takes place with the radius and the ulna, so since this is the left arm, the anatomic position puts the thumb outward. So the thumb has to be outward. The radius is on the thumb side. So you see that the capitulum is lateral because it articulates with the radius. The trochlea is medial because it articulates with the ulna. Now, the ulna has a projection called the coronoid process. When the arm is flexed, the coronoid process of the ulna goes into the coronoid fossa of the humerus. So that coronoid fossa will accommodate the coronoid process of the ulna when the arm is flexed. Not labeled, there just over the capitulum, there is a fossa there to accommodate the head of the radius when the arm is flexed. That would be called the radial fossa just over the capitulum. The coronoid fossa is just over the trochlea. And so those are the structures on the front side of the left humerus. So let's go to the unlabeled version and see how you do. Okay, if you use the rules that I gave you for determining right from left, then you should position the humerus with the head pointed toward the body's midline and the olecranon fossa on the back side. So if you do that, then what you have here is the right humerus. That is the right humerus. The image on the left there is the front side. The image on the right is the back side. Okay, so I'm curious about how you did in labeling these. Number one, that is the greater tubercle of the humerus. Number two, that is the intertubercular sulcus. Number three is the lesser tubercle. Number four is the deltoid tuberosity. Number five is the lateral epicondyle. Number six is the radial fossa. Number seven is the capitulum. Number eight is the trochlea. Number nine is the coronoid fossa. Number 10 is the anatomical neck. And number 11 is the head of the humerus. Looking at it from the back side, number 12, that is the surgical neck. Number 13 is the deltoid tuberosity. And number 14 is the olecranon fossa. All right, how did everybody do? Well, I hope you did fine. If you didn't, go back and study it again. Okay, you first of all have to identify whether you have right or left radius and ulna. There are a few things that you can use to tell you. There is a very large bump on the anterior aspect of the radius. That is called the radial tuberosity. In anatomical position, the palms are facing forward and the thumbs are pointed outward. So if you have the radius in anatomical position, then the radial tuberosity should be pointed forward. Also, the radius has a styloid process at its distal end. When you have it in anatomical position, the radius must be on the thumb side. It must be lateral. The styloid process needs to be pointed at the thumb. So that's how you would position the radius to know that what you have there is the right radius. The ulna also has a styloid process. The styloid process of the ulna needs to be pointed at the little finger. The trochlear notch needs to be facing anterior. So if you position the radius and ulna properly so that those structures are where they should be, then you should be able to tell this is the right radius and the right ulna from the front. Okay, the radius has kind of a donut-shaped head and then a slightly narrower section called the neck. Then you have the big bump. The big bump on the anterior aspect of the radius is where the tendons of the biceps brachii and the brachialis muscle attach to the radius. So it makes a big bump on the anterior aspect of the radius. Okay, the olecranon process is what fits into the olecranon fossa of the humerus when the arm is extended. The trochlear notch is the smooth area of the ulna which glides over the trochlea of the humerus when the arm is flexed and extended. The coronoid process fits into the coronoid fossa of the humerus when the arm is flexed. Okay, there is an interosseous membrane that binds the radius and ulna together, but that is not a skeletal structure, so we're not talking about that today. All right, I think I have a slide for you to label the parts of the radius and ulna coming up next. Okay, this is the right radius and the right ulna. From the front side, the ulna is turned just a little bit. It should have the trochlear notch kind of pointed or facing right at you. It's turned inward just a little bit, but this is the right radius. The styloid process is pointed at the thumb. On the ulna, the styloid process is pointed at the little finger. So in anatomic position, the palm is forward, the thumbs are out. So this is the front side of the right radius and the right ulna. Number one, that is the head of the radius. Number two, that is the neck of the radius. Number three, that is the radial tuberosity. Number four, that is the styloid process of the radius. Number five, that is the styloid process of the ulna. Number six, that is the coronoid process of the ulna. Number seven, that is the trochlear notch. Number eight, that is the olecranon process of the ulna. Okay, let's move along. Okay, there are 8 carpal bones or bones of the wrist. They are laid out in a proximal row of 4 and a distal row of 4. The little funny acronym that is used by some people to remember this is Sam likes to push the toy car hard. So the proximal row does not articulate with the metacarpal bones. So if it's proximal, it's closer to the arm than it is to the hand. So when we name those in the proximal row, it goes Sam likes to push. So that is scaphoid, lunate, triquetrum, pisiform. So those are the 4 proximal row carpal bones. Sam likes to push. Scaphoid, lunate, triquetrum, pisiform. Okay, when we talk about the 4 carpal bones in the distal row, well, these are the ones that articulate with the metacarpal bones, the bones of the hand. So if they touch the bones of the hand, then they're on the distal row. So what you're looking at here is a right hand palm surface. So that's the palm of the right hand that you're looking at there. So if we go to the distal row, then the first one is the one that's going to articulate with the thumb. So that is trapezium, trapezoid, capitate, hamate. The toy car hard. Trapezium, trapezoid, capitate, hamate. So if you use that little acronym or just make one up that you like better, I don't care. The stupider the acronym, the more likely you are to remember it. So Sam likes to push, scaphoid, lunate, triquetrum, pisiform. That's the proximal row. The toy car hard, trapezium, trapezoid, capitate, hamate. Those are the distal row of carpal bones. All right, then we have the bones of the hand. They are called metacarpals, and we just simply number them, starting with the thumb. The thumb is number 1, and so you go 1, 2, 3, 4, 5. So you would just call it first metacarpal, second metacarpal, etc. The bones of the fingers are called phalanges. The thumb has a proximal and a distal phalanx. The other four fingers have a proximal, a middle, and a distal phalanx. So the thumb has two phalangeal bones. The other fingers have three phalangeal bones. Okay, so again, what we're looking at is the right wrist palm surface. So imagine that this is the right hand and the palmar aspect of the right hand. Uh, this particular illustration was for the purpose of showing a broken scaphoid bone. So that's what that big black arrow is pointing at. The scaphoid bone is fractured there. That was the best, oh, well, it was the only image I could find that wasn't already labeled. So I put the labels in myself. So let's do the proximal row. Sam likes to push. Proximal means it's closer to the arm than it is to the hand. So these bones do not articulate with the bones of the hand. So name them first. Sam likes to push. Number one, scaphoid. That's the one that's fractured there. Number two, lunate. Number three, triquetrum. And number four, pisiform. Sam likes to push on the proximal row. Then go to the distal row, starting on the thumb side. We always start with the thumb or with the big toe, and we number them as the first of the digits. So start on the thumb side, the bone that articulates there with the thumb. That is number 5, trapezium. Number 6, trapezoid. Number 7, capitate. Number 8, hamate. So those are the 8 carpal bones looking at it from the palmar aspect of the right hand. Okay, in case anyone is confused, what we're looking at here are the 2 hip bones and the sacrum and coccyx. The 2 hip bones also are called the os cocci. There is a right and a left. Both of those have 3 different bones that make up the hip bone on that side. So the 3 bones on each side are the ilium, the ischium, and the pubic bone. The pubic bones join together at the midline at the pubic symphysis. The 2 ilia, the large flat bones of the hips, articulate with the sacrum at the sacroiliac joint. So you can see where that is. Okay, let's just start on the left side at the top. The curved portion of the ilium coming across the top there is the iliac crest. The sacroiliac joint is where the sacrum and the ilium are joined together. The iliac crest comes to a little bit of a peak there out front. That is the anterior superior iliac spine. If there is an anterior superior iliac spine, then there should be a posterior superior iliac spine. Just look on the back side, and there it is. If there is an anterior superior iliac spine, then there should be an anterior inferior iliac spine, and there it is. Okay, so moving on down, the line pointed to the coccyx. Well, we've already done that. We are going in a circle. The open space is called the obturator foramen. The bone which is on top is called the superior ramus of the pubis. Then we have the body of the pubis, which joins to the body of the pubis on the other side at the pubic symphysis. Below the body of the pubis would be the inferior ramus of the pubis. which is continuous with the bone that you sit on. That bone is called the ischium. So you're just kind of going in a circle. So you've got superior ramus of the pubis, body of the pubis, which joins to the body of the pubis on the other side. Below the obturator foramen, that is the inferior ramus of the pubis, and then continuous with that, forming the bone that you sit on, that is the ischium. There is a vinegar cup, a deep fossa in the ilium to accommodate the head of the femur and therefore form the coxal joint. That vinegar cup is called the acetabulum. That's what acetabulum means, is vinegar cup. I'm not sure where people got that name. Okay, moving on up there on the right side of the view, what is pointed to as the ilium, well, that is actually the hollowed out area of the left ilium. A hollowed out area is called a fossa. So the iliac fossa would be the correct name for what's being pointed to there. That fossa is occupied by a muscle, and that muscle is called the iliacus. Okay, so that is kind of a brief look at the os cocci, or the hip bones. So I will give you one that you can label on the next slide. Okay, let's see how many of these you got right. So number one, that is the iliac crest. Number two, that is the iliac fossa. Number three, that is the anterior superior iliac spine. Number four, that is the anterior inferior iliac spine. Number five, that is the ischium. Number six is the inferior ramus of the pubic bone. Number seven is the body of the pubic bone. Number eight is the pubic symphysis. Number nine is the obturator foramen. And number 10 is the acetabulum, accommodating the head of the femur to form the coxal joint. Well, speaking of the femur, what we have here is the right femur from the front side, and then again from the back side. So if you position the head of the femur such that it is pointed toward the body's midline, and the patellar surface, which is the smooth surface at the distal end of the femur, so that it's on the front side. Obviously, you would want the kneecap to be on the front. Well, if the head is pointed toward the midline and the patellar surface is on the front, then you have it properly oriented so that you can tell which leg it is. So this is the right leg, looking at it from the front, and then on the other side is the posterior view of the right leg. So the femur has a head which fits into the acetabulum of the ilium to form the coxal joint. The fovea capitis is a small depressed area in the head of the femur where the ligament of the head of the femur attaches. Coming down from there, you have the neck. The large bump on the lateral aspect of the proximal femur is the greater trochanter, and the smaller bump on the medial aspect is the lesser trochanter. There is a ridge that runs between the two. That is called the intertrochanteric line on the front side. On the back side, it is called the intertrochanteric crest. All right, the body of the femur or the shaft of the femur on the front side doesn't have any name structures. We have smooth, rounded surfaces where joints take place. Those are called condyles. So you have a medial and lateral condyle, and the area above them are called the medial and lateral epicondyles. The surface where the patella sits, the patella does not attach to the femur. The kneecap or patella is actually inside the quadriceps tendon, but it sits right there on top of the patellar surface, what is labeled here as the patellar groove. I've never heard it called that, but the patellar surface is what is normally called where the kneecap sits. On the backside, or looking at it from the backside, you can see the laterally located greater trochanter and the medially located lesser trochanter, and the big ridge that runs between them is called the intertrochanteric crest. Going down to the distal end, you can see the medial and lateral condyles. In between the two is a very deep groove that is called the intercondylar fossa. Now, just above the medial and lateral condyle, actually situated between the medial and lateral epicondyles, that is a hollowed out area. Also, we called hollowed out areas a fossa. So that particular fossa there between the medial and lateral epicondyles is called the popliteal fossa. Well, first of all, I hope that you figured out which leg we have here. You must have the head pointed toward the body's midline, and you must have the patellar surface for the kneecap on the front side. If that's the case, then what you're looking at here is the left femur. So that is left side. Number one, that is called the fovea capitis. It is where the ligament of the head of the femur attaches the acetabulum to the head of the femur. So number two is the head of the femur. Number three is the neck of the femur. Number four is the lesser trochanter. Number five is the medial epicondyle. Number six is the patellar surface. Number seven is the intertrochanteric line. And number eight is the greater trochanter. Okay, going to the backside view on the right there. Number nine, that is the intertrochanteric crest. Number 10 is the lesser trochanter. Number 11 is the popliteal fossa. Number 12 is the intercondylar fossa. And number 13 is the medial condyle. Okay, this is the body's largest sesamoid bone. A sesamoid bone is a bone that is positioned inside of a tendon. So we have a very large tendon, the quadriceps tendon, which attaches the four large muscles of the anterior thigh. Those are called the quadriceps muscles. So that tendon attaches to the tibial tuberosity, And inside of that tendon, we have the patella or the kneecap. So you would position it with the flat side, which is called the base, up top. You position the pointed side, which is called the apex, on bottom, and then the smooth side goes against the patellar surface. So that's how you would position the patella to know which one you have and to have it oriented correctly. The base has to be up top, the apex down at the bottom, and the smooth surface has to be against the patellar surface of the femur. And so that's how you would position the kneecap or the patella so that you know which one you have. Well, the weight of the body comes straight down the femur and then is transferred to the large bone of the lower leg, which is the tibia. There are two smooth, rounded surfaces on the head of the tibia, which are called the medial and lateral tibial condyles. They articulate with the femur, and they have between them and the femur the cushions, which we call the medial and lateral menisci of the knee. So the large expanded portion of the tibia is just simply the head. It has a medial and lateral condyle. In between, there is kind of an elevated, raised up area called the intercondylar eminence. That fits into the intercondylar fossa of the femur. So you have then on the front side or the anterior aspect of the tibia a large bump that is the tibial tuberosity. That's where that large quadriceps tendon attaches to the tibia and it pulls the bone out to form that big bump. So that is the tibial tuberosity. At the distal end of the tibia, you have the medial malleolus. In order to determine do you have this positioned right, well, the medial malleolus needs to be medial. So make sure that you have the head of the tibia up and the medial malleolus positioned medially, and that will tell you whether you have the right or the left tibia. Alongside, on the lateral aspect of the tibia, not so much a weight-bearing bone, but a balance-keeping bone, the fibula. We only have a head, a neck, a shaft, and at the distal end, we have the lateral malleolus. So that medial and lateral malleolus, those are those two big bumps on the sides of your ankles. So just make sure that the lateral malleolus is lateral and the medial malleolus is medial in order to determine whether you have the right or the left tibia and fibula. So I'll give you one to identify on your own on the next slide. Well, this is a perfectly lousy illustration, but it was the best one I could find that didn't already have labels and lines on it. So I think you should be able to identify the things that are pointed to there. Number one, that is the intercondylar eminence. By the way, we are looking at on this particular view the right tibia and the right fibula. So number one, the intercondylar eminence, that's the ridge of bone that is positioned between the two tibial condyles. So one is the intercondylar eminence. Number two is the lateral tibial condyle. Number three, that is the head of the fibula. Number four is the lateral malleolus of the fibula. Number five is the medial malleolus of the tibia. Number six, there isn't anything shown there, so I'm just pointing to where it should be. We should have a big bump right there. That would be the tibial tuberosity. Alas, we make it to the foot. All right, we have 7 tarsal bones. The tarsal bones are the bones of the ankle. The 2 weight-bearing bones are the talus and the calcaneus. So the weight of the body comes down the femur, down the tibia, right onto the talus. And the talus sits right on top of the calcaneus. So those are the weight-bearing bones. For keeping of balance, the other bones are positioned there. The navicular is right in front of the talus. And then we have 3 cuneiform bones starting at the big toe side. That would be cuneiform number 1, the next one over cuneiform number 2, the next one over cuneiform number 3, also called medial, intermediate, and lateral cuneiform bones. On the lateral aspect, against the, well, I will say on the little toe side, that big box-shaped bone there is the cuboid. The bones of the foot are called metatarsal bones. They are numbered 1, 2, 3, 4, 5, starting at the big toe. The bones of the toes are called the phalanges. The big toe has 2, a proximal and a distal phalanx. All of the other toes have 3, a proximal, a middle, and a distal phalanx. Okay, that'll do it for this show. See you next time.